All right, good afternoon, and thank you for joining us today for the new stimulus bill updates from Washington. We're going to be focusing on the American Rescue Plan Act today. I'm Jackie Petroselli, the marketing specialist here at MP. For those of you joining us today on a webinar for the first time, MP is a full-service human capital management services company offering a suite of products and services, including HR, payroll, benefits administration, time and attendance, and compliance. We support our clients with cutting-edge technical solutions, as well as proactive, reliable service and deep HR and payroll expertise. MP is wired for HR and helps clients succeed by tying their operations to their business goals. Your presenter today is MP's VP of Client and HR Services, Paul Carelis. Paul has over a decade of experience in the HR consulting space, working with businesses of all sizes and in all industries. Paul and his team of certified HR professionals at MP assist clients with compliance, training, and full circle HR guidance and support. And with that, I will hand the mic off to Paul to get started.
Thank you so much, Jackie. Welcome, everybody. First, a quick legal disclaimer. This presentation is coming from an HR best practices perspective. I am not an attorney. Please don't construe the information as legal advice. And when it comes to programs like tax credits and other things that affect finances and taxation, we also advise that you speak with your tax advisor as well. In terms of the topics that we'll be presenting today, we're going to do a general overview of the American Rescue Plan. It's important to note we're going to focus on a couple key areas of the bill today. If you're looking for information about the Employee Retention Tax Credit or ERTC program, I highly suggest you get the recording of last week's webinar where we took a deep dive into that. If you're looking for information on other grant and funding programs as part of the American Rescue Plan, things like the Restaurant Revitalization Program, the Shuttered Venues Grants, and emergency disaster loans, we do have a webinar next week, next Thursday, on those topics, on the other funding options. So the 2 points that we're going to really focus on today, aside from ACA expansion, which we'll talk about in a moment, but what I felt were really the 2 biggest administrative burdens and challenges for employers coming out of the American Rescue Plan. And those are the FFCRA expansion for COVID-related sick leave, as well as the new subsidies available under COBRA continuation. We'll also cover some frequently asked questions as well. So first, what is in this bill? Well, it's hard to really summarize the bill in a brief way or even in the course of an hour-long seminar. It was over 240 pages of legislation, so a ton in there, a ton that we won't even touch upon today. What we're really going to focus on today are the items in the bill that have some HR component or a component that speaks to businesses in the business world. So as everyone knows, the kind of headline grabber of this American Rescue Plan were the $1,400 stimulus payments. There's also a continuation through the end of September of the $300 unemployment supplement. The ARPA, as we call it, American Rescue Plan Act, also provides up to $20,400 in unemployment compensation in terms of not taxing that amount. So it boils down to $10,200 per individual. But if a couple is married and filing jointly, and if they were unfortunate enough to both have unemployment compensation, for a married couple, they can claim up to $20,400. Again, it's up to $10,200 per individual that can be exempted from taxation at the federal level. There's also an increase in the child tax credit as part of this bill. They're still working out the details on how that's going to be issued. It looks like it may be monthly payments starting as soon as July. And then another really big development as a part of ARPA was the opportunity for businesses to increase the maximum contribution for FSA dependent care. So historically, and as long as I've been in the industry, the maximum FSA dependent care contribution has always been $5,000. What this bill does is more than double that. So provided that a company wishes to increase their maximum contribution. FSA dependent care for the rest of this year, those contributions can be up to $10,500. So a really significant jump there. Some other pieces of the bill, the ERTC, or Employee Retention Tax Credit Program, where the stimulus that was passed in late December of last year extended the program into first and second quarter of 2021. This bill extended it throughout the end of the year. So it also created ERTC programs for quarter 3 and quarter 4. And where these are measured separately and allow for up to $7,000 in tax credits per employee each quarter, this means that if the stars align for you and you qualify for all 4 quarters and the math works out just right, you could realize a refundable tax credit from the IRS of up to $28,000 per employee this year, which is a huge number and adds up very quickly. The new bill also created pathways to ERTC credits for new businesses who started after February 15th of last year. Those companies had previously been excluded from the ERTC program. And it also lifted wage caps for companies that they consider severely distressed. And that's defined as businesses whose gross receipts have dropped more than 90% as opposed to when compared to 2019. The ARPA also provided an additional $7.25 billion for the Paycheck Protection Program and PPP loans. Also added some additional funding for shuttered venue operators grants and added some changes to the way that those grant programs work. Again, more detail on that next Thursday. Also provided some additional EIDL, which are the Emergency Disaster Relief Loans, some additional funding for those, as well as more money into the Restaurant Revitalization Fund, which is a really huge program. And if you're a restaurant or drinking establishment and feel that you may qualify for these, I definitely recommend you tune into next week's webinar, because it looks like there's some ways to get quite a bit of money from that program if you otherwise qualify. So one of the things that really hasn't got much coverage at all, but it is a really significant change, is the Affordable Care Act expansion contained within the American Rescue Plan. Some experts have called this the biggest change to the ACA since it was originally started a number of years ago, I believe back in 2016. So let's go over what these changes are and how these may impact businesses. So first, this expansion of the ACA is funded through the bill through 2023. So these are things that are going to be in place for a couple of years. The main thing that the ACA expansion does in this bill is provide subsidized premiums to individuals who are beyond 400% of the federal poverty line. So for 2021, that means individuals who earn more than $51,540. Typically, and in years past and before this was passed, anyone earning more than that did not qualify for subsidized coverage if they got health insurance through the marketplace or the healthcare exchange. This removes that cap completely and instead looks at the out-of-pocket cost for an individual and decreases individual contributions. It essentially, what it does is caps the cost to individuals at 8.5% of household income. So rather than going by that federal poverty line limit, if your household income, if the cost of the plan exceeds 8.5% of your household income, it provides subsidized coverage, or at least a partial subsidy to help pay for those premiums. Also, it also expands the number of individuals who are eligible for a complete subsidy of their premiums, meaning they pay $0 out of pocket for their health insurance that they obtain through the exchange. This bill increases that to up to 150% of the federal poverty line. So essentially anyone earning less than $19,320 per year can, if they're not eligible for affordable coverage through their employer, qualify for 100% covered insurance through the exchange. Based on some research and studies done by the Kaiser Family Foundation since this plan is passed, they estimate that these changes will provide subsidized coverage to 20% more Americans than the previous rules do. So under the previous rules, 18.1 million Americans were eligible for subsidized coverage. That's going to bump up to 21.8 million under the new bill. They also estimate that this will make 63% of currently uninsured Americans eligible for assistance through subsidies. And of those figures, 4 out of 10 will be able to obtain free or nearly free health insurance through this program. So you might be asking yourself, okay, I'm a business, I offer insurance. Why do I need to worry about the Affordable Care Act and people getting their insurance through the exchange? The really big reason as to why you need to be paying attention to this and why you want to make sure you're in full compliance with the Affordable Care Act is because people going onto the exchange and obtaining subsidized insurance is what triggers ACA penalties for businesses. So you can be out of whack with your ACA compliance. You can not be offering insurance to the folks that you should, or you can be offering insurance to people and have it not be affordable to them. No harm, harm, but no foul in most cases. But what would trigger a penalty in those cases where you're out of compliance with ACA is if one of your employees goes to healthcare.gov or goes to their respective state healthcare exchange and obtains coverage and gets some portion of that subsidized. That's what triggers the penalties from the IRS for failure to comply with the ACA. So it goes without saying that if there are more people eligible for subsidies, that increases your exposure to potentially have an employee going on there and obtaining subsidized coverage, and from there triggering an ACA penalty to you and your business. So the advice here is really double check all of your ACA information. Make sure you're offering insurance to the folks that you should be. Make sure that there's at least a single employee only low cost option that is affordable to as much of your staff as possible. And really just double check, because there's going to be a lot more opportunity for penalties under this ACA expansion. If you do happen to be an iSolved user, we've got some really great ACA reporting tools available. There's a report that will, based on payroll data, tell you who's considered ACA full-time and who should be offered insurance, as well as run your benefit plans against the income of your employees to let you know which employees may not be being offered affordable coverage. Okay, let's move right along to new sick and family leave. So for those of you who have been in business during the pandemic, you'll recall that last year there was mandatory FFCRA for many businesses, which meant that you had to provide at least 2 weeks of paid leave to employees who were under quarantine orders, were confirmed or suspected to have COVID-19 or had been in close contact, as well as time off to care for family members with COVID-related issues, and then up to 12 weeks available to employees to care for children when their daycare, school, or childcare arrangements were closed due to COVID-19. You may also recall that in the quarter that just ended, this past March 31st, that there was an optional continuation of that for businesses. So what passed in ARPA was kind of a renewed FFCRA benefit. It's important to note that this continues to be optional, like it was last quarter. So you're under no obligation necessarily to offer this to your staff. To be eligible for the tax credits associated with it, to essentially reimburse you for the wages you're paying, you do have to have 500 or fewer employees. What this FFCRA program does, this iteration of it, is create a new 2-week emergency paid sick leave benefit that can run from April 1st through September 30th. So for those of you asking about employees who have used emergency paid sick leave last year or in the first quarter of this year, this gives them a new bank of 2 weeks. So if you do have employees who use this FFCRA COVID leave in the past, they get a new 2-week bucket should you choose to participate in the program. Similar to the last time, you will be reimbursed in full through tax credits for the wages and other payroll costs you're spending on these employees on this qualified leave. And as of right now, unless things change, you would be eligible for credits for time taken for these reasons between April 1st and September 30th. It also extends the emergency or extended family medical leave program. We are awaiting DOL guidance on this. It should be coming any day now. It doesn't appear based on the language in the bill that there's a new 12 weeks afforded to folks who already used their 12 weeks previously. This does mirror the FMLA, the Standard Family Medical Leave Act program. So definitely if you have employees that have taken FMLA either for the childcare issue or for other FMLA reasons, they would still be subject to that 12-week maximum. But this does provide the 12 weeks, different from the previous FFCRA, where there had previously been a 2-week waiting period to be paid for EFML. This new bill does make all 12 weeks of EFML paid. So what this means is that if you participate fully in both programs and have an employee who's eligible for all of it, you could potentially be looking at 4 weeks of job protected paid leave under FFCRA. Because those first 2 weeks are paid, there is still the $200 daily limit for EFML, but with those additional 10 days paid, it does bump up the maximum benefit and maximum tax credit to you from $10,000 to $12,000. And another significant change is that whereas previously the only allowable use for the 12 weeks of EFML was for those childcare issues and when a school was closed or when a daycare was closed due to COVID-19, this new bill opens up emergency family medical leave for all of the reasons that FFCRA can be used for, including the emergency paid sick leave reasons. And again, we are awaiting DOL guidance on this. So to refresh your memory, the reasons that you are allowed to use FFCRA: the employee is subject to federal, state, or local quarantine or isolation orders related to COVID-19. The employee is subject to the advice of a healthcare provider to self-quarantine related to COVID-19. The employee is experiencing COVID-19 symptoms and seeking medical diagnosis. The employee is caring for an individual subject to an order described in the first 2 bullets or in self-quarantine as described in the second bullet. The employee is caring for a child whose school or place of care is closed or child care provider is unavailable for reasons related to COVID-19, or the employee is experiencing other substantially similar conditions as identified by Health and Human Services. So in addition to these reasons, the new bill also adds a few more. And those are the employees obtaining a COVID-19 vaccination. Obviously, this wasn't in place in the previous iteration because the vaccine didn't exist at that time. The employees are also allowed to use this leave to recover from injuries, disabilities, illnesses, or side effect conditions related to the COVID-19 vaccine. Or lastly, the employee is seeking or awaiting results of a COVID-19 test or diagnosis because they've been exposed or you as the employer requested the test or diagnosis. So that was some language that wasn't quite clear in the original version, and they use this third bullet here to clarify that. So some other things based on what we know now, and again, all of this is pending the ultimate DOL guidance that should be released very soon. But employers can choose to offer the extended paid family leave, the emergency sick leave, both, one or the other, or neither. That is completely up to you. One other important aspect of the new bill and the language as related to FFCRA is that they put in some pretty strict non-discrimination rules in there. They made it very clear that should you choose to participate in this program and be able to take advantage of the tax credits associated with it, that it's really important that you offer it universally across the organization. And they specifically pointed to concerns regarding discrimination toward favoring highly compensated employees, employees with a greater amount of tenure, or full-time employees rather than partial or part-time employees. So if you do choose to participate, it's really important that you offer it to everyone and not just select groups of people. So some questions that we received on this topic. We didn't participate in FFCRA this past Q1, but want to now promote vaccinations and participate. Can I do that? Yep, you can restart offering the program now, even though it is optional. You will want to notify your employees in writing if you are choosing to participate in this. Another question that we received is asking whether or not they can opt into this program only allow it to be used to obtain vaccine. It doesn't appear that that's going to be permissible. Again, we'll await what the DOL says, but it seems again like you really just if you're gonna be in, you got to be all in. All right. So next, let's talk about COBRA changes, and this really might be the most burdensome piece of the legislation for employers, especially if COBRA is something that you manage in-house. So with the new COBRA guidelines and the new subsidy program, it's important to note that this does apply to both federal, people who are subject to the federal COBRA laws, meaning you have 20 or more employees, as well as smaller businesses who are obligated to follow state continuation, sometimes known as mini COBRA rules. For the federal COBRA followers, based on our interpretation, and this is another program that's awaiting some really important DOL guidance, it does appear that these subsidies will apply to health insurance, dental, vision, as well as HRAs. And it does not apply to FSAs, only HRAs. And a term that we're going to be using as we talk about this topic is an assistance eligible individual. We may abbreviate that as AEI. But an AEI is defined as an employee who had a reduction in hours or an involuntary termination, excluding gross misconduct reasons, and whose COBRA maximum period had not expired as of April 1st. So what this means and why this really causes a burden is that you have to go back depending on the situation. Most commonly, it's an 18-month time that an employee can, or an ex-employee can be out on COBRA leave or obtain COBRA continuation. My apologies there. So essentially, you really need to go back 18 months potentially to see who may qualify as an AEI. And then you're going to have to send them some notices, and they're going to have an opportunity to potentially jump on your health plan via COBRA and have it be 100% paid for. AEIs are also individuals who become eligible for COBRA during the COBRA subsidy period. So the COBRA subsidy period is April 1st through the end of the third quarter, so September 30th. So if anyone has a reduction in hours or is involuntarily terminated during that time, they're considered eligible, as well as individuals who had previously been on COBRA or elected COBRA but dropped it for any reason, including non-payment, and provided their eligibility would have extended through the subsidy period. So again, that their 18 months hadn't run out. We also have to look at individuals who did not elect COBRA, but are eligible during the subsidy period, especially folks that recently terminated involuntarily. So what these new COBRA guidelines provide are first a new 60-day election period. So giving those individuals who meet some of those requirements we just talked about a 60-day window to decide to jump into COBRA. It's important to note that this does not extend the maximum COBRA period. So again, if someone's 18 months are going to run out sometime between now and the end of September, they'll still run out when they would have otherwise. They will automatically be extended to the end of September. As I said a moment ago, the 100% subsidy is provided from April 1st through September 30th. Don't worry, if you're concerned about having to pay this and how you're going to be reimbursed, the costs are covered and you are fully reimbursed via Medicare tax credits. It does appear, and again, we'll see what the DOL says, but it does appear you can be reimbursed for up to 102% of the premiums. It does appear that there's going to be a mechanism to get paid in advance for these so that if there are cash flow concerns about funding the healthcare premiums for these individuals, that you will be able to claim in advance on that tax credit. When it comes to those of you who are under 20 employees and follow state continuation, you're going to want to talk to your insurance carrier, as it appears that the law requires them to cover the cost of the coverage. One other important note is that for these individuals to truly be eligible for the COBRA subsidies, it's important that they're not eligible for other disqualifying coverage. So if they're at a new employer and are able to get insurance there, they wouldn't be eligible for this. So when we talk about administrative burden, what does that really mean? So at the end of the day, it looks like there's going to be 3 separate required notices for certain cases. The first of which is a modified version of the COBRA notice that you or your COBRA administrator sends out now whenever someone is potentially COBRA eligible. So if they terminate, if they have a reduction in hours, just like you would normally, you are going to have to send them a COBRA notice. It's just that there's going to be new language speaking to this program in there. According to the bill, the Department of Labor has to provide model notices and further guidance by April 11th. We'll see if that, we're hoping that they meet that deadline. We will see. Another notice that you'll be required to send is that 60-day election notice to anyone who's considered an AEI. There will be a model notice provided by the Department of Labor. And then the 60-day election window for them will start as soon as you send them that notice. It's important to note that as an employer, you're required to send all of your AEIs this election notice no later than May 31st. For any individual whose COBRA coverage will expire prior to the end of the subsidy program, you are going to have to send them a letter informing them of when their COBRA will expire. And there's another wrinkle in there that, should you want to, usually COBRA continuation is a continuation of the plan that they had been on at the time of their loss of eligibility for the health plan. But with certain rules, you are allowed to potentially give them other options to consider for their COBRA coverage. Okay, so definitely got some panic calls when people looked at the calendar and saw these due dates and wondering if they just need to send something out. No, definitely want to advise to wait until these DOL model notices come out. They should really get, the concern is that if we try to take a guess at what it should look like, that we miss some required language or something like that. So it's really best to just wait. It should be coming very soon. But do keep in mind that you don't want to wait any longer than May 31st to send these out. Another question, just concerns about funding this as a small business. And as I said before, it appears that insurance carriers are going to be covering the cost for businesses with under 20 employees. All right, so realizing that this COBRA subsidy program especially can be quite confusing, I wanted to go over a handful of scenarios. So let's talk about some employees and determine whether or not they'd be eligible for this revised COBRA and the COBRA subsidies. First employee is Mark Matthews. Mark was laid off due to pandemic-related economic downturn on October 1st of last year. Mark has since picked up a part-time job, but isn't benefits eligible. Based on the criteria and what we know in this example, it does appear that Mark would be eligible for subsidized coverage starting on April 1st and have that subsidy run through the end of September. Based on a standard 18-month window, Mark should be eligible to continue on COBRA, albeit at his own cost after September 30th through April of 2022. The next employee is Jenny Jones. She was terminated back before the pandemic on January 1st of 2020 due to performance issues, just wasn't a good fit, wasn't a high performer. She's currently working, not as an employee and not associated with our sample company here, but works instead as an independent contractor for Instacart. Based on the facts here, Jenny should also be eligible for subsidized COBRA. It doesn't really matter that her termination wasn't COVID related. It was involuntary. Lackluster performance generally isn't considered gross misconduct, so she should be eligible for subsidized coverage from April through June, but because her termination was so long ago, it appears that she would lose eligibility to continue on COBRA in July. Okay, and then let's look at Fred Jackson. So Fred resigned from the company on June 12th of last year to start a new business. His new company does not yet offer health insurance. Fred wouldn't be eligible for the subsidy and the COBRA extension because his termination was not involuntary. He quit on his own accord. So he would not be eligible for the subsidy. All right, let's next look at Paloma Harvey. Paloma was terminated due to the shutdown in April of last year. She's now employed at a local retail chain and works full-time and is eligible for benefits. Paloma wouldn't be eligible because she has disqualifying benefits eligibility at another employer. Roy Ricardo is being laid off this August. He's still working at the company now, but is going to be laid off because the company is moving to a smaller facility and downsizing. Rory will be eligible for subsidized COBRA in the months of August and September, and then we'll also have the option of continuing COBRA at his own expense through February of 2023. And then lastly, let's look at Johnny Pearseed. Johnny was terminated back in May during the pandemic for punching a customer. Johnny remains unemployed, hasn't been able to find gainful employment since. Based on the facts here, our argument is that Johnny is not eligible for the subsidy, even though he was involuntarily terminated. We do feel that physical violence could be considered gross misconduct, which makes him ineligible. So there you have it. That is a quick rundown of a couple of really key aspects of the American Rescue Plan. I hope that you found that informative. Should you have any questions, we encourage you to reach out to us. Our website is chock full of information at mp-hr.com. We have a number of blog posts, ebooks, as well as our past webinars and our upcoming webinar schedule. As I mentioned before, we're going to go into some of the alternate funding programs afforded through the American Rescue Plan and other stimulus programs. We're also going to be doing a return to work series in the coming months where we tackle issues that employers are facing as they start to bring employees back to their physical work locations. So again, I thank you very much for your time, and please feel free to reach out to us if we can be of any assistance at all. Thank you.